I don't know whether the doctors here in India will tell you, but of course in the West, they tell them that, we have fertilized this many eggs and you have this many embryos and then you can use it in the future. So what happens is usually they will fertilize almost somewhere between 10 to 15 eggs, which means you have now 10 to 15 embryos leaving babies in those dishes which are frozen. So when you transfer few, and there is also again a lot of problem that it goes into that you transfer 4 and then 2 implants and then 2 will be like miscarried, and sometimes you run into some other problems like selective reduction, which I will talk about later. So there's a big question here that what will happen to the rest of the embryos, because there are only 3 options that you have with these leftover embryos. First, either you implant all of it and then you try to give birth, but if we see it humanly, it may not be possible right now. It is not safe for a woman's body and for those babies too. And second, option you have with those embryos is you keep them in ice, in freezing for like indefinitely, or as long as like you can keep them. Or the third option is you either destroy them. So destroying embryos equals to abortion, killing, murder, because those are living babies. So if you are a Christian, a believer, and you believe in that life begins at conception, and to know that we don't have to go to even Bible, that life begins at conception. Science proves you that life begins at fertilization. And there is one more option that these days, some embryos, it's taken by the hospitals and those embryologists to do some eugenics, some experiments, and to check some genetic things and all, and ultimately they test them and then they destroy them. So what about those innocent children? Because those are your babies, right? So this question is there. What about those babies? What will happen to them and who will fight for them? Because they are just there frozen. I have heard testimonies of couples, Christian couples, who went into IVF without thinking much, without considering much options. And then when they already implanted now 4 embryos, it's implanted, and then you have now 4 babies and you don't want to have any more, and then you are done, or you develop some sickness or cancer or some life-threatening disease where it's not possible for you to have any more children. So then they realize the seriousness of this issue and the question that now we have left another 10 embryos, our babies, in the fridge. Now what are we supposed to do with that? And that question hits them after they are done with it. As I said before, I will talk about selective reduction. So this is another problem that the couples run into after implantation of the embryos. So usually, I think you have also seen that, and you have also heard about somebody in your locality or in your church or in your society that they went through IVF and they have twins. So usually, not all the time, but usually they have twins or even triplets. So this is because doctors, they want to give the embryo the maximum chance to implant. So sometimes one baby will implant, one embryo will implant, and the others will not, and they will be miscarried. So to avoid that, what they do is at once they will transfer up to 3 to 4 embryos. Usually it's 3 or even 2, but up to 4, and they expect that at least 1 or 2 will implant, even if not all. So but sometimes, in many cases, what happens is all the 4 embryos implant, and the woman is pregnant with 4 or 3 babies. But again, it's not very practical to have 4 babies at once. Sometimes, maybe in rare cases, but not every time. And sometimes the woman has issues because she has already taken so many hormones, the body is already whacked up, and then this is not a normal pregnancy, right? It's like you are injected with a lot of hormones and your body is prepared with the medications, so you already have so many issues, and then you have this heavy pregnancy with like four. So what the doctors will suggest is you do selective reduction, which even the name itself is like so heinous, wicked, that you have to choose among your children. It's like you have in your womb, so two boys and two girls, so you want to go with two boys, or you want to go only with two girls, or you want to go with one boy and a girl, and then rest, your term is reduction. So you reduce, you have four, but now you can reduce your children to two. So, I mean, what logic is that? And then how would you take that, getting, being pregnant with four, and then you knowingly, you have to make a decision to keep two of your babies and then let go of two. So these are the heavy, hard questions that you are thrown usually into IVF. And then many couple, I'm sure that you will not know this. Many women, they don't know this. I want you all to consider serious questions before go through this process of IVF. I can understand, this the longingness to have a baby, and it's a good desire because it's the desire given by God. God in the beginning itself gave us the blessing to multiply. Multiplication happens through babies. So I can understand the desire and the longing, and it's painful. I have many of my relatives in my family who are dealing with this, who are trying to conceive baby for many years, but they are not able to. I have my close friends who have dealt with it and are still dealing with it. So I know the pain and the struggle. Your pain is real, I know that. But I also want you to consider the question of right and wrong, because when it's like IVF, it is like you are the client. Nobody is talking about those babies. Everybody is talking about the happiness of the parents and making your family whole, bringing happiness home. But what about the happiness of those children who are still frozen because they are already living being? I want you to consider these things before you opt for it.